Hi everyone, how you doing? Today's I would like to provide you some information about the frequently questions relate to the COVID-19 vaccination. Um, First of all, thank you for coming back to my channel. For the new one, if this is the first video that you see for my channel, please don't forget to subscribe my channel so you can receive my next coming out videos. Thank you. Uh, so here's the information about the vaccination for the COVID-19. A lot of people have a question about that, and I pull out the information from CDC. Um, so, um, a lot of people asking about um, if you already have or getting the COVID-19 or infect the COVID-19, so which one is longer, the vaccination, the vaccines, or the immune system after you getting the COVID-19? Which one is last longer? Um, so at this time, CDC say, they are still learning. So they don't know, they don't have the answer yet. The protection someone gain from having the infection is depend on the disease, and it's also vary from person to person. Uh, and because the virus is new, CDCs don't know how long the immune system might last in your body. So right now, currently the event that suggests that getting the virus again is the uncommon in 90 days after the infection with the virus that called the COVID-19. So in another word, like if you get infected, the COVID-19, so you have your system is immune in the 90 days after the first infection. But it stay for how long? CDC don't know yet. They don't have the data yet, so they need to invest more and learn more rewriting about this. Another question that people always have is, what percent of the population need to get the vaccine to have the herd immune to COVID-19? So the herd immunities mean that enough people in the community are protected from getting a disease because they already had a disease or they have been vaccinated. So at this moment, the experts don't have the information yet. The percent of people who need to have protection in order to archive the herd immunity vary by the disease. And the CDCs also say like they are studying right now. So they will provide more information when it's available. People also wonder about what are the ingredients in the COVID-19 vaccines. So there is two, right now you can hear a lot, there is two COVID-19 vaccines currently available in the United States, which is the P-Filler Biotech's COVID-19 vaccines and the Moderna COVID-19 vaccines, right? And though do not contain eight positive allergies. So they have the full ingredients or the vaccines for recipient and caregiver. So you can click on, or you can go to the CDC website and get more information on that. Another question people also wonder is who paying for the COVID-19 vaccines? When you go there, do you have to make a payment? If you don't have the insurance, or do you have to pay the copay, something like that? So at this moment, the vaccine, though purchased with the U.S. taxpayer dollar, and it's giving out to American people at no cost. But however, the vaccination provider can charge you administration fee for giving someone shot. For example, if you go to the Walgreens or CVS, they may be charging you a fee, the administration, because they are the one who have staff to give you a shot. But the vaccination provider can be reimbursed for this charge by the patient publics or the private insurance companies. And for the uninsured patient, the Health Resources and Service Administration provider relief fund also can help them to cover the cost for uninsured patient. So no one can be denied for the vaccines if they're unable to pay the vaccines administration fees. Another question have is how CDC make the COVID-19 vaccine recommendation. So when the Food and Drug Administration authorize or approve the new COVID-19 vaccines, they hold a public meeting to vote on whether to recommend the vaccines or not. So after that, they get the vote and to making the recommendations for who should be offered to get the COVID-19 vaccine first when the supply are limited. And the CDC's is make the recommendation for who should be offered the COVID-19 vaccine first. And each state have its own plan for the vaccines priority, including the distribution and allocation. So if you would like to know more information about that, you can go directly to your state website, health department, for more information. Some other question they asking is when it will be my turn to get the COVID-19 vaccines, and what's to expect at the COVID-19 vaccination appointment, how to protect, etc. So when is your turn? Again, you can contact to your state health departments to find out the informations. But also, right now it's on, for Massachusetts, for example, they are on phase 2, which is adult who 75 years old can go and get the vaccination. And then the next group will be like 65 and up, and etc. But I suggest the best is going to your school, your state website, and get more information on the plan. What can you do to help protect yourself from getting the COVID-19 until you get the vaccines? That is another question. So the CDC suggests that to protect yourself, you need to wear a mask over your nose and mouth and stay at least 6 feet away from others. Avoid the crowd. Avoid the poor ventilation space, and also wash your hand often. So those is the basic things to help you um, get infected from the COVID-19. So if another question is like, if you has a COVID-19 and recover, do you still need to get the vaccinate with the COVID-19 vaccines? This is a very great question. I think a lot of people have a question about this. So yes, that is the answer from the CDC. Due to the severe health risk association with the COVID-19 and the fact that reinfection with the COVID-19 is possible. So the CDC recommend you should get the vaccinate regardless of whether you have already have the COVID-19 infection or not. And if you were treated for the COVID-19 symptom with some of the antibodies, the plasma, so you should wait for 90 days before getting the vaccines. But talk to your doctor if you're unsure what treatment you receive, or if you have any questions, further question about the COVID-19 vaccines, talk to your doctor. I think they are a great resources and a persons you need to go to. Um, Another question also asked is, will you require to get the vaccinate for work? So at this moment, the federal government do not mandate or require the vaccination for individuals. For some healthcare worker or essential work employees or state or local government, they may require or mandate that worker to get the vaccinate at the matter of the state or the law. So again, the best information is to check with your employer, check with your boss, check with your workplace to see do they have any rule that apply to you. Do you need to wear a mask and avoid close contact with others if you got 2 doses of the vaccines? Of course, that is the answer. That is the recommend, and then to be safe for you all the time, avoid close contact, wear mask, stay 6 feet away, wash your hand often, because that is helping you and prevent the spreading in the community or you to get infected. To be cousins is always a great thing to do. So how many shots do you need to get for the COVID vaccine you needed? So right now, the vaccines for the COVID-19 require 2 shots. One of them, the BioNTech, should take 3 weeks apart, like 21 days apart. But for the Moderna, though they're giving like 1 month apart. So if you take the shot this month, next month you will get it, the second shot. But when you go to take the vaccines, they will set another date up for you. So don't worry about that. If they forgot, asking them during that time. One of the other question asking is, can you get the COVID-19 vaccines at the same time as another vaccines? The answer is wait at least 14 days before getting any other vaccines, including the flu shot vaccines. So if you get your COVID-19 vaccine first, then wait for 14 days to get another, to get the flu vaccine, for example, right? Um, um, Regarding about the vaccine distribution, um, one of the questions is more popular is when will COVID-19 vaccine will be widely available in the United States? So at this time, the manufacturer is very lack quality of vaccine taking time. So the goal is for everyone to be able and easy to get the COVID-19 vaccine when it's available for distribution. Um, so the CDCs and the advisory committee um, have published the recommendation for which group should be vaccinated first. So, due to the limit of the supply. So you just like go back to CDC website or check with your state website to find out more information. What is the next group will be available to get the vaccinate. Um, so readings about the vaccine safety, right? A lot of people also asking about it. Is it the COVID-19 vaccines is safe? People question about it. Um, according to the CDC, they say the COVID-19 vaccine is being used have gone through uh, a, a, a study, a good time of study to ensure that they are as safe as possible. Um, so, but again, this is also like new. So they are also like learnings at the same time, right? Even though they have the clinical trial for the vaccines, and they find out the effective, the safe, the effectiveness before the vaccines, um, in order to authorize and approve for use. So they have been testing and research about that. So um, pay attention to it, and for also learn more about how the federal partner ensure the safety of COVID vaccine in the United States. You can go to the website of the CDCs and find out more information about that and learn more. Um, what happens if you are pregnant or breastfeeding? Is getting the vaccines is safe for you? Um, so at this time, they don't have any data uh, available to show about that yet. But people who are pregnant and part of the group recommended to receive the COVID-19 vaccines may choose to be vaccinated. So you have the options. Talk to your doctor, talk to your healthcare provider. They may help you to make the decision. Um, so another question asking, is it safe for you to get a vaccines if you are underlying medical conditions? So people with underlying medical condition can receive the FDA authorized COVID-19 vaccines, provided they have not had any like immediate or severe allergic reaction to the COVID-19 vaccine. So again, if you want to learn more about this, the vaccination is very important consideration for adults of any age with a certain underlying medical conditions, because it will be because those people are at risk for severe illness from the virus that caused from the COVID-19. So um, you know, it's important. The vaccination is very important consideration for those group. So what happened, where do you have to report if you have the problem or you have the bad reactions after get the COVID-19 vaccines? This is also one of the great questions. So if, for example, if you get the COVID-19 vaccines and you think you might have a severe allergy reactions after leaving the vaccination site, the best way is seeking immediately medical care by calling 911 or go directly to emergency to seeking medical treatment. And then you also can report the side effects or reactions using either the V-cell or the vaccine alert event report system. So they have the website, CDC have the website to check in for people to report, the symptom or the side effects, so they can be monitored. Also, the healthcare provider will be required to report a certain, to follow up on the vaccination, to make sure, those people is under the care. Another question have asked is there any risk for severe allergy reactions if you receive the vaccines? The CDC mentioned that the serious problem from the vaccination can happen, but they are rare. CDC had learned of the report that some people have experienced a severe allergies reactions after getting the COVID-19 vaccines. For example, they may need, if they have the severe allergies reaction, some people, they might need a treatment of the EpiPen, or they must go directly to the hospital or emergency, to get the immediate treatment and care. So basically from these videos, I just want to share with you the frequency questions about the COVID-19 vaccination that people have been reading about this during this time, and hope this information is helpful to you and your families. If you like my videos and if you think this is the great information to share with your friend, your family member, please do so. Thank you for listening, and look forward to see you on my next video. Bye.